I'm Alexis Guild. I'm the Director of Health Policy and Programs at Farmworker Justice. Welcome to our interview series revisiting the state of farm workers in the COVID-19 era. This series is aimed to raise awareness about the impact of COVID on farm worker communities and the work being done to support farm workers and their families. Farm workers have been disproportionately impacted by COVID, largely due to their poor working and living conditions. According to Purdue University's Food and Agricultural Vulnerability Index, close to 500,000 agricultural workers have been diagnosed with the virus. But that is likely an underestimate of COVID's impact on farm worker communities. Since the start of the pandemic, Farmworker Justice has been working with partners across the country to ensure farm workers are able to stay healthy while continuing the essential work of feeding our country. We are here today to discuss the impactful work being done by farm worker serving organizations to respond to the COVID-19 pandemic, empowering farm workers to achieve workplace protections and access healthcare and community resources. Today, farm workers are starting to access the COVID-19 vaccine. However, more work needs to be done to ensure farm workers are able to get vaccinated and to address their living and working conditions and improve their access to healthcare. Today, we are joined by Deliana Garcia, the Director of International Projects and Emerging Issues for Migrant Clinicians Network. We'll be discussing the work of Migrant Clinicians Network to inform and provide resources to farm worker communities about the COVID-19 vaccines. Thank you so much, Del, for joining us today.
Thank you, Alexis, for inviting me.
Can you just start off by telling us a little bit about Migrant Clinicians Network and the work that you do?
Absolutely. So the Migrant Clinicians Network is about 32, 33 years old now. We began originally as a grassroots group of clinicians, all of whom were caring at that point for farm workers as their principal patient population. Over time, we've now grown into an international clinical network with a large professional staff and 4 offices across the country, and then some satellite staff that work in areas like environmental and occupational health, climate change, trying to do education for clinicians, including community health workers, as well as doing education for workers who can be adversely affected by their living and working environment. And then we do a lot of work in infectious disease because that seems to be one of the areas that is always affecting workers across the country.
So you've been doing a lot of work around the COVID-19 vaccine. Can you tell us a little bit about, are farm workers being prioritized for the COVID vaccine currently?
You know, I think what we're seeing across the country is a real mixed bag, Alexis. You have organizations like Health Resources and Services Administration that is now trying to make sure that health centers can be sites for vaccine distribution, and they are scattered across the country. What happens, though, is that they find themselves in individual states that are not prioritizing farm workers. And so there's this slight sense that if they step out of bounds, prioritize workers outside of the 50 and older or comorbidities segment, that they will somehow then run afoul of the state and potentially lose ground as a vaccine delivery site based on, the state output of vaccines. So you have a lot of organizations, such as in Florida, the Coalition of Immokalee Workers and the Growers Association have been trying very hard to make sure that farm workers are prioritized, and yet that has not happened at the state level. On the other hand, on the West Coast, you have California and some of those counties, up in the valley and throughout, who are doing a great job. And they've prioritized farm workers and they're getting out to them, and farm workers are getting vaccinated. So it's really a big mixed bag. I mean, I think people want desperately for workers, for farm workers to be prioritized, and yet there are also a lot of other groups that feel they too should be prioritized. And then it becomes sort of a battle between the deserving. It is not that anyone does not deserve to be vaccinated. It is that if you have limited supply, then access is restricted, and then decisions get made on that grounds.
Absolutely. I think the patchwork has been extremely challenging for farm workers. And, you mentioned the migrant health centers and the fact that they're receiving vaccines, but then they must adhere to these state guidelines,
Right.
and yet these farm workers are their population, their priority patients. Can
Exactly.
you talk a little bit about some of the challenges that farm workers are facing accessing the vaccine, and also maybe a little bit more about what migrant health centers are facing trying to provide the vaccine to workers?
I think it's a lot of what we hear for other populations as well is, that they may be coming into an area. Do they know where they should go to look for a vaccine? Do they even know where to look for how to find where there is a vaccine? The processes that have been put in place by some locations in terms of you have to have internet access, you have to have an account with them, you have to have a password, you have to have an email where, invitations can be revisited. What we see frequently in a lot of communities is the time between sort of registration and then your notification that you have an appointment, and that exact appointment is not even 24 hours. And that you have workers who are working all day, every day, in the position to be able to check their email that frequently and know that they're going to be called to then be vaccinated. I think we have many workers who lack transportation, so that if the vaccines do not arrive where they are, then they would not have the ability to get even to an available site. And what we also see is, and I do not mean to cast any kind of aspersion, is that we have a lot of work locations that are apprehensive about inviting the vaccine providers on site, because somehow they believe that then that gets interpreted as you must accept the vaccine. And if you do not, your work is in jeopardy. And that they don't believe that that's the position that they should be taking. They want to make it available. They'd like for all of their workers to have access to it. Certainly, they'd like for all of their workers to accept it. But it has to be the case of personal choice, and that it needs to be then that it is available to them, but that they are in a position to refuse or accept. And I think we see health centers running into that as well. Many of the health centers do collect their information in terms of worker groups, and so they can tell you who their farm worker patients are. But there are other health centers that have such a mixed population in terms of the standing community and homeless and housing and school-based, and they don't always have a clear understanding of who their farm worker patients are. Or the question has been asked, what are you working at? What is your current employment? And the person will say, well, I'm unemployed, because it's not the season. And so then they don't classify them as a farm worker. They classify them as someone who's unemployed. So I think that there's a lot around location, transportation, that access piece, but then there's also the issue of data, and which data are being required and how they're collected, and then how they're deploying that data to make decisions about who will be vaccinated and how that will happen.
Absolutely. And I think the issue with data also goes to the fact that we don't know how many farm workers have contracted COVID. I mean, I said that there's an estimate, but that's an estimate. And we don't know how many farm workers have been impacted. We know they've been impacted, but we don't know exactly how many because of that lack of data collection.
Exactly. I mean, really, could you even give me a solid number of farm workers in the country? So if you can't estimate your base population, what is your N? And so then anything over that is really just a guess.
Absolutely. Have you been hearing about any myths that are pervasive in farm worker communities that may contribute to some vaccine hesitancy among farm worker communities?
There's a lot going on with that. Hesitancy is really interesting because I think some of it is strictly distrust. Some of it certainly is mythology. The myths of they're trying to put a chip in your arm so that they can always track you and know where you're going. That it hasn't been tested. It got rolled out so quickly. Really, we're the human subjects. Those are things that you do hear, not just in farm worker communities, but really across the board. And then I think what you also see among many groups is, who are they receiving the message from? And is it someone that they trust or someone that they even know? And I think in many situations, it's not so much hesitancy because they wouldn't accept vaccines, because they do come from a part of the world, that Latin America has some of the best vaccine rates in the world, much better than the United States. And so it's not an appreciation for vaccines in and of themselves. It is this particular one in this environment with all the political messages that have been out there and this real sense of distrust at who is the messenger and what's being said and why is it being said to me and is it being said to everyone, because I hear mixed messages. And so are other people being told the truth and I'm being told a lie? I think it is such a confusing environment for everyone, Alexis. They want to be well informed. They want to know that they've got a trusted mechanism for communication and information. And that is not always the case because they find themselves in a new location. So then who is that person or what is that mechanism for trusted communication? It's pretty fraught for everyone.
Absolutely. So what is Migrant Clinicians Network doing to help share information to ensure that farm workers have accurate information about the vaccine and helping them connect to be able to get the vaccine?
We've started a number of things, Alexis. We do a lot of training to clinicians so that we can prepare them to really be good informers of their patient population, giving them a wonderful video that was done by our board chairperson, Eva Galvez. She's a physician from Oregon, where she describes very clearly how mRNA vaccines function. And so we've made that available. We've done some deep education for clinicians at all levels. And for us, clinician extends from the field, community health workers and outreach workers, promotores, all the way to the exam room. So, nurses, advanced level practitioners and physicians, to make sure that everybody is getting the most reliable information that we have that day. And so we always date everything we're doing with, this is what we know to be accurate today, the 15th of March, 2021. And so, everything is dated that day to say, this is where we're going. We have some beautiful printed pieces. Years ago, we issued a calendar that was done by the style of Mexican restaurant calendars. And it was a big poster that had the backstory of a farm worker who is working, and a coworker says, hey, you need to put a long sleeve shirt on because you're getting a lot of bites. And he said, oh no, it's not a bite. It's the scar from my smallpox vaccine. And they start talking about vaccinations, and they talk about the importance of adult vaccination. And then there's a tomato that's done sort of like an Aztec calendar, and it lists all of the adult vaccinations, when they're given and where they're placed. And so we've reissued that now to include COVID-19, either the 2-dose or the 1-dose injections versions. And that will be now distributed across the country to as many users as would like to have it. We've also initiated a Yo Me La Puse campaign, which is, I had it given to me. And we have, an older adult and a young male and, people at different vaccine sites, just, showing the Band-Aid, saying Yo Me La Puse. And again, Eva Galvez at the end saying, if you have a chance, because there's that whole issue of if you advance expectations and heighten everyone's desire, and then they can't get a vaccine, that you're doing everybody a disservice. So the statement is, when you can, be sure to get it. And so we have that going on. We're doing some work with a variety of different groups. We're doing some radio programming. Radio Conciencia in Florida is a group with whom we've done a lot in terms of spots. The Yo Me La Puse is also an audio spot, and so we're really looking to provide tools and then identify the trusted communicator. Who's the person who's going to have the best entree? And have we made something that would be useful to them to communicate with the people in their community?
As more vaccines become available, so currently there are 3 vaccines, but 2 of them require 2 doses, which for some workers can be very challenging in order to be sure to get that second dose. What are some challenges as more vaccines come on the market, trying to talk about these different vaccines? And then for those workers who get the 2-dose vaccines of Pfizer or Moderna, what are some challenges in that realm? And is there anything Migrant Clinicians Network is doing to help offset those challenges?
Right. I mean, I think what they try and say is, well, why one is two and why one is one, and is the one less effective, and you're just trying to give me sort of a basic dose. And so that's why I think it's been really important for us to have good education around the different ways in which the vaccines are created, but to try and say consistently, our effort here is to reduce extreme illness and hospitalization, and certainly to prevent death. And so that if we keep making that our message, that's an important thing. We also have had a program now for about 26, 27 years called Health Network. And what we've done ultimately is put in a portal so that a health center that is registered with us can go in on their own and insert information about the farm worker patient that they gave the first dose to, tell us what they got, Pfizer, Moderna. We'll have everything else listed in case it comes up, and what date that was given. It will automatically generate for them the date of the next vaccine, the second dose. And you input then just first name, last name, date of birth, and contact information. We'll immediately be in touch with the farm worker. And then 10 days out, we'll start again. This is us. Where do you think you're going to wind up? And then, a few days out, did you actually wind up going there? Because what we want to do is get them a source for the correct vaccine. Even though CDC has said that in extreme cases, you can mix Moderna and Pfizer, we don't feel like there's any need to do that if what you can do is look for a good source and then inform the worker and try and make sure that their issues around transportation and time and everything else are dealt with. And then we want to be able to go back to that original clinician and say, your farm worker got their second dose. This is when they got it. This is where they got it. And in that way, then we would have truly some farm worker specific data. And we're working with some health centers for them to tell us estimated population, number that were offered, number that accepted, number that were in place for that second round, so that we can start talking to one another about this is what we got to see during this vaccine period. Albeit a small number of centers, we at least are able to say our N was this, and this is where we got.
The Health Network has been such a great resource, I know, for so many health centers and so many migratory workers. And as the vaccine continues to be rolled out, I'm sure it will continue to be a lifeline for many workers to ensure that they're connected to a vaccine. Can you tell people who are interested how they can connect with Migrant Clinicians Network and connect to your resources and learn more about the great work that you do?
Absolutely. I mean, it's very simple. Our website is www.migrantclinician, all one word singular.org. In there, you can search for any of your topics that you're interested in. Our COVID resources are there front and center. You can go to our staff, and in there is the ability to contact each of us in turn. I'm listed there if you have any additional questions about something that I've said, or you're with a health center that's interested in the Farmworker COVID Vaccine Network, you can contact me and we'll keep going.
Well, we certainly encourage everyone to go to your website. We've had a great relationship with Migrant Clinicians Network, and so we are so thankful to have you join us. Thank you, Del, for being a part of this interview series and sharing all of this great information. We really appreciate it.
Thank you for inviting me. And I think this is wonderful. I'm so glad that you are doing this, and I'm so glad that you're trying to collect as many voices as possible, because I think it is that show of collaboration and unity that's going to be so urgent.
Absolutely. Thank you again. Thank you so much, Del, for joining us.
Thanks.
And thank you to all of those at home watching our program, revisiting the state of farm workers in the COVID-19 era. Farmworker Justice is a nonprofit national advocacy organization that works at the federal, state, and local level to empower farm workers to improve their immigration status, living and working conditions, occupational safety and health, and access to health care. Our work is made possible with the help of our generous supporters. So please visit farmworkerjustice.org to become a supporter today and stay up to date with our COVID activities and other ongoing priorities. You can rewatch this episode and the rest of our series, as well as the interviews from last year's series on the state of farm workers in the COVID-19 era on our website and on our Farmworker Justice YouTube channel. You can get connected with us also on social media by following us on Facebook, Instagram, and LinkedIn at Farmworker Justice. and on Twitter at FarmWRKR Justice. Thank you for joining us.